before it was clear that the overall survival was the main goal to be reached by the therapy. Now we can see, as data are accumulating, that TKI therapy is extremely useful. We have to follow it in a very careful and precise manner, but certainly it can be endowed also with some small but consistent and persistent amount of toxicity that would be very nice to eliminate. And this is becoming clear as long as the follow-up is becoming longer. And therefore, I think that it's very important to set up a new era for CML therapy, which is, will be devoted certainly to the real cure of the disease, which means can be defined in several ways, but substantially means that the patient can stop the treatment without having a relapse of the disease. And this is our aim. Certainly, better results have been obtained with stronger TK inhibitors. Sometimes, however, these inhibitors are endowed with some intrinsic toxic effect. So we have always to balance which is the benefit and which is the risk for the patient. But certainly we have opened now a new path, which is what is called now path to cure, which means the possibility really to have a complete cure of the disease without the need of continuing a therapy for the rest of the life, even because this probably is just an illusion. We can see that even patients who are starting with imatinib, after 7, 8 years, only half of them are still on imatinib therapy. So they've changed therapy for several reasons. And therefore, I would say the idea, this was really an illusion at the beginning, that the patients can be assigned to a specific treatment, that it will be with him for the rest of his life is not totally correct. And therefore, we have to change a little bit our mentality. This, of course, together with the patients who should be aware of the new goal of the therapy.